All right, welcome back. We are on week 4 of our licensing lunch and learn. It's very good to see folks returning and getting what they need in preparation for taking the licensing exam. Just to get you all going, let's just do a quick recap on the first 3 sessions, and you can use the chat for this. So what was statement, tip, idea? What was your biggest takeaway from sessions 1 through 3? It can be a word, a phrase that a presenter said, anything that gets us to recall some of the tips that was discussed in the last 3 sessions. And you can put what you recall in the chat. Okay, thanks Amanda for kicking us off. Going over example questions. Yeah, we spent a lot of time last week going over examples. Setting consistent, regular study time. Good job. Oh yeah, study calendar. Thank you, Carmen. Yeah, a lot of study schedules. So yeah, we spent our first 2 sessions really laying the foundation for how to study. So the small, frequent reviews, being intentional about pulling information out. So understanding what do you know and how well you know it. And then week 3 was when we started to dive into questions. And Dr. Keys did a really good job at pulling out some case studies and calling on you all. You all were very good at the interaction, and I hope that was helpful for you. So we're at week 4, where it's around stress management, anxiety management as it relates to taking the exam. So we have Dr. Lisa O'Donnell here, expert in bipolar disorder in the workplace, which I'm a big fan of her work in that area. I will let her, give some more information about her background, and then continue on with what she has prepared for you all today.
Thank you so much. Thank you everyone for having me. And I'm excited about this topic. This is something that I can relate to. I've done a lot of work professionally with it, also personally as well. And so I'm hoping that I can provide some information and talk about some specific strategies that might be helpful for everyone. What I thought I would do is I want this to be more of like a Q&A discussion format. I don't want, and I do have a few slides I can show, but I wanted to really get a sense first of what all of you are hoping to get from this. So let me give you a little bit of background first, which might help you think about the type of questions you'd want to ask. So I'm a professor here. I've taught mostly clinical classes and master level, doctoral as well. So my main classes I teach are DSM, cognitive behavioral therapy, integrative theories, which is a new class in the master's program. And so with those, and also I have been a clinical social worker for the past probably 17 years now. And I've spent a lot of time working at an organization, a practice in Ann Arbor that specializes in treating anxiety. So I've worked a great deal with people with OCD, as well as anxiety diagnoses, such as generalized anxiety, panic, social anxiety, the whole category. Now, I'm also aware that we are humans and we have anxiety, and that's a natural state that we experience. And so not everybody who has anxiety has an anxiety disorder, and it can be useful regardless of the degree of anxiety you have to understand ways to manage it, particularly when you have something coming up like the licensing exam, and that can cause some natural anxiety. It's totally normal to have, and to think about how to prepare and manage that anxiety as the exam approaches. So I would like to really target what you would, like to get most of this. So would anyone be willing to start off with sharing in the chat, or you could unmute yourselves and give me a sense of, what would be helpful? And then I can go from there.
How about talking a little bit about test anxiety, or how to relieve test anxiety?
Okay.
I'm one for getting all the information and being prepared, and then when I get to go for the test, I get the anxieties.
Okay. Yeah.
If I made
And-
sense, I'm sorry.
No, that
Yeah.
makes sense. And so I realized too, what I'm going to do is I'm going to step back and define a little bit of what anxiety is, how it affects us. And then I can talk about, thank you for that, Carmen. I appreciate you sharing that. And then I can get into how do we think about, when that anxiety comes up related to test taking. So test taking obviously could be coming up now. I know, for example, in the DSM class, there's an exam. In the CBT class, there's a take-home exam. But we don't have them as regularly, right? I think in undergrad or even in high school, it was much more likely to have exams. So I don't know how many all of you are having, but my point is the less frequent you have exams, the more anxiety we can have, right? Because we're not as used to it, and it's not such a regular practice. So first, I want to talk about what anxiety is. And I am open. If you have any questions as I'm talking, please feel free to interrupt me. But anxiety is the body's natural response to stress. And we know that to be the case. Everybody has anxiety, right? We have fear, which is a natural state that we are programmed instinctually to have. And it's a very useful, valuable, emotional, physiological reaction, right? It's a state of unpleasant nervousness and a feeling of fear or apprehension about what's to come. So we all have it. Now there's helpful anxiety and then there's unhelpful anxiety, and there can be a bit of a curve with that. So I want to talk about specifically what to do. So when is anxiety helpful? So would anybody be willing to answer that question? So normal adaptive anxiety is an experience where you are reacting to a realistic threat or danger. It's like a warning signal, right? It prompts us to prepare mentally and physically for action. So Carmen, you said that you do prepare for the exams quite well, and that might be your anxiety driving some of that, right? That we have that unpleasantness and we kind of want to get rid of it. And so what we tend to do is find ways to do that. But would anybody be willing to share some examples of when you can imagine anxiety is actually quite helpful and adaptive?
I'd like to speak if I can.
Please, Erica, thank you.
Thanks. Okay, so I would say that it would be helpful, say, for example, you have a project due or a paper due or something like that, something that you have to do, and there needs to be some form of or a sense of urgency. Quite naturally, if you're preparing for it, there will be a certain level of anxiety, but that should motivate you to try to prepare for it so that you can be prepared for whatever the task may be. I would say that would be kind of like a helpful anxiety, because if you're not worried about it, not stressed to the point to where it paralyzes you or has a negative effect, but it motivates you to say, okay, you know what, I'm a little nervous about this. Let me make sure that I'm prepared for it. So I don't know if that would constitute as being helpful or not.
Absolutely. That's a perfect example that I think probably being a student, you can relate to, that if you have something coming up, an assignment, and there's a due date, as you get closer to that due date, you might start to feel a little bit of anxiety rising, right? And that is generally, for a lot of people, they find that to be helpful, that it's on your mind more. You feel a little bit of butterflies when you think about it. You start wondering how you're going to approach it, and then you're already preparing for it. And that's a very good use of anxiety, assuming that it stays in that helpful zone, right? So thank you for that. So that's a perfect example. Obviously, if I'm sure some of you have heard of the fight, freeze, and flight response, right? And those are common ways to respond to anxiety, where, we freeze up if something. So if you see, if you're in the woods and you see a large animal, or you hear, you might see a big brown blurry figure, you might hear some rustling, your immediately reaction is going to freeze, right? Because you're going to try to like, listen, what is that? Figure out what's going on. And your body is responding in that way. So there's also a survival purpose that years ago, like when we think about cave people, that was quite necessary. And that was a very prominent experience that they had. Now we don't need that as much because we live in a much safer environment. So there's very helpful anxiety, but then when anxiety becomes problematic, it actually interferes, right? It's when the anxiety is disproportionate to the risks and the severity of the possible danger. So the way I like to think about it is anxiety is a fear reaction. And if you are reacting to a situation as if you are in the woods and there is a bear or a large animal that might be a threat, but in fact, you're sitting next to a little golden retriever puppy, but you're having the reaction as if it's a real threat or danger, that's when anxiety becomes problematic and it actually becomes impairing, right? So somebody with a phobia, for example, or somebody with an anxiety disorder. So the anxiety is excessive in frequency, intensity, and duration, and it's excessive relative to the situation. Now, I wanted to give a little background. Thank you for humoring me on that. But now I want to get to Carmen's question. Yeah, Christina, I saw your comment too, and thank you. It can motivate you to work more diligently. And I think that's sort of a modern day use of anxiety. And so there are different ways to approach if you have an exam coming up, or if you have an assignment. And one thing we've talked about, that it sounds like, Carmen, you don't experience as much, but some people can really benefit from, is preparing for the exam in a number of ways. So this is sort of like prior to the exam, and then I'll talk about what to do on the actual exam day. So obviously you want to prepare by studying the content, whatever the exam is, but there are other ways of managing anxiety. So one thing that I think can be very useful is when you are studying for the exam. So this might be a standardized exam, or it could just be an exam in the classroom. Try to create an environment that is very similar to the actual test taking environment. So put your phone away, have just exactly what you would be able to have in the environment. So, maybe not snacks or drinks or any, having your pet on your lap, or, just having electronics around, having music playing, things that you might do when you're studying. But as you get closer, try to recreate the exam environment as closely as you can, because that'll sort of put you in the mentality. Because there is a bit of a, I don't know about you guys, but when I have moments when I realize I can't have my phone or I can't have access to the things I'm used to, there's a little bit of anxiety that pops up. It's a discomfort. And so if you're already kind of prepared for that, that can be really useful. Does anybody have any questions about that in particular, or any reactions to it?
I was going more for where I get a block when I'm
Yes.
taking the test.
Okay. So when you're actually in the exam, so what can be helpful is the morning. Okay, so a few more prep things, Carmen, is if possible. I know, for example, I've had students share with me when they were taking the ASTB licensing exam, they actually drove to the driving site before, like, know what to expect when you're getting into, and that can reduce some of the anxiety, because when you're about to take the exam and you're already experiencing anxiety, the more anxiety you have prior to it, the harder it's going to be in the moment. So you want to do your best to prepare. So if you have an exam, let's say late morning, afternoon, try to clear your schedule the day of, the night before, really get a good night's sleep. Obviously, we always get told that, but it's easier said than done, right? When you're anxious, it's hard to sleep, but do your best to create a calming environment. Wake up, maybe go for a walk, clear your head. Do some type of, like, if you can find an app online that you like for breathing meditation, relaxation techniques, but really try to keep your anxiety managed prior to going in. Now, a really big thing we know with anxiety is the way that we're approaching things, how we're thinking about things. So really pay attention to the thoughts that you're having prior to the exam, and then Carmen, when you're actually going into the room, because that block is a reaction to some anxiety that's already been rising, right? And so what are the common thoughts that we tend to have when we're about to take an exam? I'm going to fail this. I don't know enough. I'm not prepared. I'm going to blank out. That's a big one, right? My mind's just going to go blank. So you're going to start to have some thoughts that are going to raise your anxiety, because we know that in terms of cognitive behavioral theory, and we know that CBT is really the most effective psychotherapy or versions of CBT for anxiety, right? So we know that cognitions are what change how we feel and our behavior. So you might start pacing a little bit more. You might start, your heart's going to start racing. You're going to start sweating. You're going to be breathing a little bit shorter. You're going to notice that you're having physiological reactions to this thought of like, oh my God, how am I going to do? Did I study the right things? Am I going to forget when I get in the room what's actually what I studied, all of those things. So what I want you to do is when you pay attention to those thoughts, I want you to ask yourself, which thought is really kind of the most potent for me right now? Like, which one seems to be creating the most anxiety? Is it that I'm going to fail this exam? And then you think, yeah, that's it. You might feel it. And when you have that thought, I want you to ask yourself, this is my favorite thing when I think about responding to cognitions. I want you to ask yourself, what would I tell a friend right now? Not what would I tell myself, because we're much harder on ourselves. But ask yourself, based on where you're at in your academic life, have I failed a lot of exams? Do I tend to fail exams? Did I prepare adequately for this exam? Let me think about the studying I did. I put a lot of studying into this, and I studied this, and the professor recommended I study this, and I did all those things. So you really question the thoughts that your anxiety is telling you, either right before or during the exam. Just ask yourself, what is my anxiety trying to do to me right now? Because anxiety is really tricky and it's not very nice sometimes. And so you want to catch those thoughts, and then just before you go in, really remind yourself, are these accurate? Is my anxiety right? Usually anxiety is a really bad fortune teller. That's what I like to think of anxiety as. If it was a fortune teller, it would be broke, because it would tell people really negative things that would never come true. And so ask yourself about that. So paying attention to your thinking is very key. Now I'm going to take a break. I'm talking a lot, and I see I have a question. Erica, please go ahead.
Yeah, so I have a question. So my question is, I had a coworker who I believe was probably suffering from this, and it started to kind of make me have anxiety. But they had taken the social work licensing exam about maybe 8 or 9 times, and they weren't successful at it. They said that each time they took it was totally different. They had taken some training programs or test prep programs, and things of that nature, and they were just like, I keep failing and I don't understand what I'm doing wrong. And so I had said, well, maybe you're having, like test anxiety, but they prepared and we actually prepared together. And although I haven't taken it yet, they took it again, and I don't think they were successful again. And I'm trying to understand, because then I started getting a little like, oh my gosh,
Yeah.
She's a very smart person. I mean, and it's not based on smart or not smart, but you know what I mean? So I was just, how do you kind of overcome that?
So you overcome that particular person situation or your own anxiety.
Well, mine, I say, I have to black that out. I can't like internalize that and take ownership of that to say, oh my gosh, like, is it that hard? Because you may not, because I started finding myself being a little insecure about about it at first, but then I'm like, no, you know what, I'm a pretty good test taker except for time tests, so that's what I'm going to need to practice as far as time tests, so
so this and this connects a bit with, I know I hadn't completely finished answering Carmen's question. This connects a bit with that, and then there's something else I will say specifically about the situation. But so there is a type of I guess, social anxiety, it's like performance anxiety, right? And there's a test taking anxiety. So there are people who have, you know, many people are predisposed genetically to have anxiety disorders or just to have a baseline of anxiety, right? That is something we can't control if it runs in our family. And this particular person, if she's preparing adequately, you studied with her, you got a good sense that she seems to get it. She's practiced, actually, like practiced exam questions, like really prepared for this in an appropriate way, then it sounds like it could be something happening in that moment, which could be test taking anxiety. So if it's so severe that she's failing it like that many times, that's when I would recommend seeing somebody. I would go beyond the exam preparation, like professionals, but I might consider maybe a therapist who specializes in test taking anxiety, because that can be a huge problem, and that might be it. And that's so much money. I think about taking it that many times. It's really expensive, you know?
And that's what she was mentioning too. She was like, this is so expensive, I can't afford it. Like, this is,
Yeah.
and she's like, I feel, and actually, and I think because also the employment that she had previously to where we were working had ended because she didn't get her license in time. You know, she had a certain, she was in the school system, and I really felt bad, you know, for her. And I knew that that was something that was very heartfelt for her. So yeah, that's very helpful.
Yeah, sure. And I have like 10 things I want to say now. And I know there's another question, but these are wonderful questions. And I just, it's such an intimidating process. But so let me go back to, if you're actually taking an exam and all of a sudden your anxiety rises and your mind goes blank and you're like, what do I do in that moment? That is when I like to think of anxiety, because this is accurate, as almost I externalize it. What is my anxiety telling me right now? What is my anxiety doing right now? Is it a physiological response? Am I thinking negatively about this moment? If your mind is blank, it's more of a physiological. And in that moment, just close your eyes and really take some deep breaths. What we know with anxiety is we get in that fight or flight mode. And what happens is, this part of the brain where the limbic system, the fight or flight system, when that kicks in, this part of the brain, it's harder to access. And this is the part of the brain we need to take the exam. So this is the problem solving, the abstract thinking, the, like thinking through like all of the questions and accessing information. And so when this part of the brain is like kind of taking over, it's really hard to access that and actually answer the questions. So what you want to do is I almost like to visualize that I'm trying to shift the way that my brain is functioning so that I'm moving it here. And so what can I do in that moment? My breathing is probably quite rapid. Can I slow my breathing down a little bit? Depending on the environment, you can't do this with standardized testing, but if you have a professor that you know and you've said, hey, I get anxiety sometimes, if you need to get up for a moment, go get a drink of water, like kind of do something to calm. If your professor will let you do that, that's okay too. Try to have a conversation beforehand. But the idea is to really just don't panic, because that's what it is. Oh my God. And just say, it's okay. My anxiety is trying to take over right now, but I have control over this. So what you do is, how do I take control of my body? You can stretch your arms, you can move them, you can deep breathe, whatever's going to help you. Stand up for a moment if your professor will allow it, and just sort of regain control of your body, and then try to sit back down and focus. And know that those 30 seconds that you're going to do that minute that you're going to take to sort of regain the control in your body is going to be okay. You're not going to fail the exam. It's actually going to help you. Okay, so that's another point I wanted to make. I'm happy to get into a little bit more of the licensing exam and sort of how to approach that, because it is a very challenging exam. I've taken it. It's been a long time, but I remember the process was a bit scary. But I know that there were some questions. Thank you so much, Chantalea. I appreciate it. There was a question. Let's see. There was a hand up. I attempted to take the exam a couple of weeks ago, and I became more anxious when I saw the timer of how much time I had. Yes. So two things to do about that, Christina. One is, again, when I said, when you're taking take practice exams at home, try to recreate, put a timer in front of yourself. Like, again, try to recreate that situation as you're preparing again, so that you can kind of get used to that, right? And if there's a point where, like just looking at the timer is not helpful, just do your best not to do that. But I would definitely, I can see that be intimidated, and I would try to just have that timer there and get used to that feeling when you're practicing it. Yeah, the timer can definitely be nerve-wracking because you're just counting down like, oh my God, how much time do I have left, right? It's definitely scary. Okay. Nokalita, did I pronounce that correctly? I know you've had a question for a while.
Yes, yes. How are you? Can you hear me?
I can. Hi.
Hi. Okay. So I've taken the exam a few times, and I tried to gauge because I heard somebody else say earlier that it's a lot of information, the timer's there, you're reading the questions. The questions are so long.
Yes.
And I am I have the type of mind that drifts off when I am reading. So I asked them to do if I could get accommodations, because to try to assist me with the reading component of the exam. And I requested, I do better when I hear. I'm an auditory type of person.
Yeah.
So I asked for auditory component for the exam. And I got really discouraged because I did have a doctor provide me with the information. It was pretty lengthy information, but they still wanted more information, so I've actually been not able to go back and take the exam because I'm trying to do everything that I can to prepare myself to take the exam.
Yes.
But that process is so lengthy.
Yeah, I didn't realize it was so lengthy, and I'm not surprised, but I'm sorry that's happening. And then it just delays, when you can take the exam. Now, I'm glad you brought that up, because that is if you do have a diagnosis, if you have a learning disability, a mental health disability, a physical disability, with hearing, vision, anything that's going to make it affect your test taking, then you absolutely want to get documentation, request accommodations. It sounds like it's a bit of a process, so the sooner the better. Now, that if it's if it's something like anxiety and you do have a diagnosis of it, again, I'm going to keep repeating myself, but one thing, so I'm similar where when I'm reading, my mind wanders and I have a very hard time staying focused, especially when I'm anxious. And then, you catch yourself, right? You catch yourself like, oh my God, I was just thinking about how I'm going to fail this exam, when actually I was not reading and comprehending what was on the screen in front of me. So one technique, if you do get accommodations and you can take it, if nobody else is in the room, you just have like a proctor there, but you're just sitting there, I would ask them if you could read the question out loud to yourself. I think that could be really helpful if you have trouble focusing, or mouth the words. That's one thing I would do, is really, as you're reading it, not if you can't do that because there's people around, you can't talk out loud, to even just try to mouth the words. Now, my biggest advice for preparing for the exam is to take practice exam, just do them over and over and over. And Nokalita, if I'm pronouncing that correctly, that is going to really give you a sense of the style of the questions, how they're worded. And so that makes it easier when you're in the moment and you're having trouble focusing, because we know if you've done it over and over, they ask a lot of questions about what would you do first in this situation? What's the next thing you would do in this situation? They're worded in a way where they're looking for all answers are going to be reasonable, but they're looking for a particular thing that you would do immediately. And so the more you practice these exam questions and you start to get a feel for what it is they're looking for, like what does ASWB want me to be saying in this moment, that can also be helpful with the focus when you're actually taking it, because there's a familiarity with them, which could kind of make it a little bit easier to pay attention. So I don't know, hopefully that's helpful.
No, it was. It makes sense.
Good. And let's see, Carmen, you had another question, right?
I did. But
Can
it
I
must
ask?
have,
Oh, sorry.
it
I was
must
gonna,
have been.
I
Yeah,
was
go
gonna
ahead.
ask if I answered adequate the first
I
one.
believe so. And you know, you're really giving us some good pointers. And that's my problem, is that I'm preparing for the licensure exam as well for my MSW. And one of the things I find is that I think it's I'm preparing, but I'm not yet prepared. And so and it's so, like she was saying, there's so much information. I keep thinking, can I hold all this information in? And I also know several people that have taken the exam several times and are failing it. And again, it's a different exam.
Yeah.
So I think that's where the anxiety plays a role. It's you know, those kind of things in my mind.
Yes.
And the other things you were saying about clearing your head and responding to the question, it's funny because that's what I do with my students. I'm in a school,
Yeah.
so
And that's what you, yeah.
I have to do that for myself. Yeah.
Do as I say, not as I do, right?
Exactly.
I'm a therapist. There's so many times I think like I should do that. Yeah. So one thing that I will give one piece of advice that might sound, you might have heard this, it might sound strange, but I've learned. So what I do is I took the exam a long time ago. So I'm just being transparent about that. But one thing I do, I've been doing for years is, you know, in our department, we have access to an actual like old ASWB exam. And so I go through the questions with my students in our classes and we talk through the rationale for the answer and you know, why did I pick this one versus what, you know, this is what they wanted. One thing I've realized is that it is not useful to use your own clinical experience. I find that actually can be problematic. So I was fortunate enough to go through training through the Beck Institute when I was, before I took the exam. I had some, like, I was, you know, being certified as a CBT therapist. And I'm not joking, I was getting the CBT questions wrong. I was like, if there's one area I should feel most confident about in taking this exam, it should be questions around that. But it wasn't about my own knowledge or my own experience clinically, because you're trained based on your organization's culture and then the environment you're in. You could be in a school setting, a hospital setting, you could be in a private practice, wherever you're learning, it's gonna vary. And obviously this is a standardized exam. So do your best to recognize what are you using to inform, like when you're answering a question, are you basing it on what you think you would do? When you're practicing and studying, I want you to approach these questions as what are they looking for, not what would I do? And that's the best way to prepare for that. At least I found. And so you want to study and you want to, you know, I know that they have like statistics on which topics are more likely to appear on the exam, and it's good to know that and memorize things and study the content. But I can't emphasize enough, just taking practice exams and reviewing practice questions is an essential part of preparing, not only for the knowledge, understanding what they're looking for the exam, but also with anxiety management.
I'm gonna ask a dumb question, maybe, but I haven't. I have to order the ASW book, ASWB, and the practice exams. Are those in the book? Or are there other resources for practice exams that you know?
Okay. Regarding the book,
Like, what do I need? What should I invest in? Or
yeah. So are you a student at Wayne?
no, I graduated from Wayne.
Okay, you're an alum though?
Yes, I'm an alum.
Okay, so we actually, and I would, if there's anybody that wants to, but I know that we have resources in our department for alum too, where you can purchase practice exams. And it is, I want to say $25. It's very reasonable. And what you get is you get registration to 2 full practice exams and then a mini exam.
Did you
And
say $25?
I want is that
Something
correct?
like that? That's okay. That's around that.
It's very low cost. I
Mhm.
know that.
I would get it
Dr.
from the
John,
social
can you
work
jump? Do you
office?
remember how much it is? You're
Yeah, it's $20, and I'm gonna put the link in the chat.
perfect.
Oh, good, thanks.
We also have other resources. For example, I think that you can connect. I don't know if it's a current student or alum, but I think that they have like coaches, like mentors, that people who've already taken the exam, and you can actually, and this is again through the department. Do you have a link to that as well? I think that you have access to that. So it's somebody that can just like walk you through the process, what to expect, help relieve some anxiety, give tips of their own, and having someone who just recently took it, that could be like really useful. I'm assuming, I don't know this for sure, but I cannot imagine that the book that you purchased, there's probably practice exam questions in it, and there might be even a link to like an online practice exam. I would imagine that's very standard with those books. So I hope there should be, but I don't know for sure.
Yes. So I actually use that link. So it's kind of like you go to the link and then there's a program, a place where you fill out your information and then they say they'll get back with you. So like I did that and nothing happened. So I'm like, I was just kind of confused on, because I've
Oh,
seen about, so I don't know how to go about what's the next step.
It depends on, and we can talk offline. I can look for your the questionnaire that you filled out. We had a change of hands in our CE office, so maybe when you filled it out, that was when we were changing from one assistant to the other. But let me, anyone who has filled out the form, you can just send me a direct message and I can look you up, and actually I can get you access to the exam today.
Okay, thank you. I definitely will do.
All right.
and the second link that Dr. John shared is great. So it's all the other licensing exam support that our department offers. So obviously this series is listed, but there's study groups, there's the practice exam, there's mentorship that I mentioned, and then a lot of resources for other, like the ASWB exam guidebook. So Carmen, that might actually be helpful to answer your question more directly.
Yeah,
too.
I was cutting and pasting that link.
Good.
So I
Good.
missed out on the last part. You said this like I'm one of them. I sent for being a mentor, and I think they said not being a mentor, requesting a mentor, and they said that it was full. So
Oh,
is that what you said? But that was before I came into the lunch series. That was a while, maybe over a month ago. So are you saying for me to let you know that I signed up for that?
Yes, Kim Easley, who is from alumni relations and is normally on the call with us, she was over or facilitating the mentoring program.
Okay.
And she's not on the call today, but she'll be on the future sessions. But I can also write your name down, Carmen, and inquire.
Okay. Please. Thank you.
Okay, can you repeat that again? So if I'd like to be on the mentoring program, this is Natalie. I send you a note.
Yes, and so send me a note. I can check in with Kim Easley, who is on vacation this week. Also, our 9th session, there will be mentors joining us for the call. So, this is a 10-week series. On the 9th session, mentors will be joining the call to talk about forming study groups. So there's a couple of things happening. So start with just sending me a note, and then I can go from there.
Okay, and then last week we got some references for the social work clinical or the general practice test. Which one am I supposed to be getting? Do I buy both?
She's you got information on the generalist practice exam?
Yeah, the books that she was recommending that we buy last week.
Oh, you're supposed to be taking a clinical exam. I think
Okay.
you're on this call, unless you're going into macro work.
Okay. So, but you're saying that we can also get it from the social work department at a cheaper price?
No, we have access to a practice exam. But we don't have, but we're not, we don't have books in the school.
Okay,
Yeah.
okay, so I'll buy the book then.
Exam that you can take, yes.
Okay, just saw that. Okay, thank you.
Okay, no problem.
So I added it was a bit bigger than I thought, but there's a link here. One thing I was thinking about as you guys were getting your questions answered is that and I'm jumping in because I realize we're almost done, but there is a wonderful psychotherapy called ACT. It's acceptance and commitment therapy, and it can be very useful for test taking anxiety. So I talked about addressing your thoughts, like what kind of thoughts are popping up in your mind, but sometimes that is a bit too overwhelming for somebody in the moment. And there's a strategy called acceptance. And it's much simpler in theory than in practice, but it's this idea, if you're familiar with DBT, radical acceptance is the term for that. But acceptance is really understanding that I can function, I can move forward and do what I need to do while the anxiety is with me. And that's it's a game changer for a lot of people. Instead of struggling, oh my God, my anxiety's here, what am I going to do? Oh my God, I'm feeling this way and that way, versus there's a bit of a shift if you can recognize, yeah, my anxiety's here. Welcome anxiety. Thanks for joining me. Could everyone mute?
I don't know how far that level was.
Thank you. But anyway, so I put in a link and there's all these free like little videos on acceptance that I would recommend if you're interested, even as a clinical social worker. They're great strategies to know for your clients, but they can be very useful for test anxiety as well.
So in other words, do it afraid.
Pardon me?
In other words, learning how to do it afraid.
Absolutely.
Yeah.
I don't know if anybody's familiar with Bill Hader, but he is an actor and he was on Saturday Night Live for a very long time. And he actually has pretty high social anxiety, which is interesting, right? That he's like on a live performance show, but he talks about this idea of he's got his little anxiety. I think he calls it like, it's like a little devil or something, but it sits on his shoulder and it goes with him. So he does he goes on stage and he does these skits and it's there. And he continues to do it while having this. And it really can be a useful approach of knowing you can't stop the anxiety from being there with you. But how can you, work with it while it's there? That's really the important part, not preventing the anxiety, but how do you manage it when it is there? Because it will be, right? Cherie, you've had your hand up for a while. I think we have time for another question. So go ahead.
Hi. So yeah, along with the test taking anxiety, I didn't want to get too personal, but I had an unfortunate occurrence. So I have post-concussive syndrome now, and I'm like not looking at the computer, and I have to take my exam because I've already renewed 6 times. So I'm in my 7th. Yeah. So 7th year, if you will. And, so I was wondering, because I have, I can think of what I want to say, but I was wondering if I could stay on afterwards with Chantalay. I'm sorry if I pronounced your name wrong. Because I can't email, I can't do any of that right now. It's like I have limited screen time, so. Because I wanted to ask about like how to get in touch with someone, like the old version of using a telephone, because I can't do an emailing back and forth.
Okay.
So I'm not as anxious as I used to be. I understand. It's like mine is like what someone was talking about, because I have a learning disability and ADHD, and I've taken it 3 times. I have I can't think of what I want to say, the accommodations. There's called non-standard accommodations. I have 6 hours. I have a snack break because I have medical and the ADHD. So it's like my thing is holding on to the information. So I need to be able to work with someone who can help me figure out, like when I sit and look at the test, like when I took it the 3rd time, I knew I wasn't going to pass, but because I had other things going on, and I was very calm because I'm like, I had no expectation, but I had to get that done because you have a certain amount of authorizations, and now to go again, they make it, anyways, I don't want to stress everyone out. They make it really difficult to be able to do what needs to get done for us to be able to pass these exams. Because everyone's brain is a little different. And so, so that's what I was wondering. I don't know if you can speak to that, but I might have to now reach out and ask them to have it, you know what I mean? It's like, because I can't study right now. You know what I mean? So I'm feeling a little stuck.
Well, you know what, why don't we discuss that a bit? We're almost done. If you can stay on.
Yeah, because
that would be great. Yeah, happy to do that. It sounds like it would be, it might be helpful to talk more about that. Are there any remaining questions or comments? I did put my email address in the chat, and I will.
So the thing is, don't keep hanging up and calling back.
Oh,
I have a question. Well, I don't even know I don't even know if it's a question or a comment or what. But I can wait.
We have everyone mute again. Thank you. Okay, go ahead, Melanie.
So I guess I can wait because I know we're wrapping up now. If I can hold, and wait to discuss, talk to you afterwards, that's fine. Because I know it's almost 1:30.
Okay. So I will end with this then. I hope that you can take away a few things from this that you can, use yourself. I hope this was helpful. There are so many strategies for anxiety management, as I mentioned, relaxation, mindfulness can be really useful. I mentioned acceptance, cognitive restructuring. There are a lot of different strategies, and it just kind of depends on, I want to say, do you feel like it's your thinking that tends to get in the way more with the anxiety? If you're taking an exam, then we want to approach more of an acceptance or a cognitive approach. If it's physiological, I highly recommend practicing some relaxation, some mindfulness, some deep breathing, and you can find a lot of free resources online and in apps. If you want more guidance on that, just email me, and I'm happy to share some more with you.
I do have one quick question, if I can. We have like 1 minute. So what would you say would be helpful if you have like multiple things on your plate that is equally as important, a lot of deadlines, and you want to get this test done? And so I mean, it's just like when you have so much to do, and then you start to say, for myself, to say, okay, what can I eliminate? Let me try to prioritize. And then you're prioritizing. I'm like, I need to study this. I need to study this because I, had signed up for a couple of training programs, and then, was doing the practice exams and everything. And then it was like life happened. And so that's my challenge, because I'm like, okay, I have to put the time in for this because it's very, very important to me. Whether I need it for my job or not, but I want to accomplish it. But there's so many things pulling at the same time, both personally with like family sickness, my mom already know that, and then also just with work projects, and then so how do you kind of manage that?
Oh, I get it. With a lot of things in life, there are like kind of fires we have to put out, daily fires, things that are urgent that need to get addressed immediately. And when those pop up more and more, it's harder for the things that aren't urgent but very valuable and important. It's easy to set those aside, and sometimes you have to do that. So I would say that if there's a point where you're like, things probably aren't going to calm down and I need to take this exam, like there's a lot of commitments that I have. I tend to do best with external accountability. And so so sitting down and just really being thoughtful about, is now the time that I really can, regardless of what's going on, I'm going to make time to study for this, and then join a study group. I think you can do that through our department. If you have a colleague, a friend who's also studying, accountability can really be important, because not only is it for you, but other people are counting on you. And as social workers, that tends to motivate us a lot, right?
Right.
And so I would think about, okay, if I have just a time carved out, it's the same time every week, and it doesn't have to be like every day, but even if you just do a little bit each week and you say, I'm protecting this time, this is the time I need to study. And unless something super urgent comes up, that is the priority for that time. And then all those other things you can just set aside for that brief time and then get back to them. And if you have other people there to really encourage you to stay committed to that, that can be really helpful.
Thank you so much. That's very helpful.
Good. I'm glad. Well, thank you everyone for coming. This